right, well, I wanted to give everybody a report from the Office of Compassionate Uses meeting today that Patty, and I went up to. I was able to speak briefly at the end of the session. The session was really interesting to the extent of really a positive crowd to get this done. There was only one gentleman that spoke even remotely to the extent of further regulating what was going on. Everybody else was very, very positive to the extent of getting this done promptly. I was really humbled by the stories that were told by the mothers of the autistic children, the patients themselves with severe debilitating conditions, the veterans, of course, that spoke. The stories, once again, just reflected what we know is that the patients who walk into our clinic here, Compassionate Cannabis Clinic of Venice, are coming here with three desires. One is to feel the best that they can and to hope for better every single day. The second, they want to do this in the most natural way that they can and avoid some of the more manufactured medicinal products, pharmaceutical products that have side effects, some that we know and some that we don't even know for the future. And then, once again, people want and need to be legal and want to be recognized for their own healthcare choices at any age, be it a mom advocating for her children or the patients, of course, advocating for themselves or the caregivers. Once again, was really inspired by the various stories that we heard. Other physicians spoke as well very eloquently to what I really feel to be the most important point right now, which is maintaining that doctor-patient relationship as the basis for making the decision on who has the debilitating condition. As we know, there are those 8 or 10 qualifying conditions that have been laid out by the state, including multiple sclerosis, Parkinson's disease, cancers, HIV, glaucoma, Crohn's disease, seizures, and of course post-traumatic stress disorder. But in reality, patients come with many other debilitating conditions as well that may not quite fit in to a real neat category in that way. So we need to maintain that each patient-physician relationship is really what maintains the sanctity of the program. There's been some talk of the Board of Medicine actually becoming involved with further trying to delineate the conditions that are going to be accepted. There was a huge outcry against that. There was also a lot of discussion about the availability of the ultimate cannabis product. Who's going to control that? Will it just be the 7 dispensaries that are now in existence? Or will it be opened up to smaller growers, more growers, even individual home growers? Also, of course, discussion, and I brought it up at the end of the session, was to the extent of the CBDs that are now out there available via internet or otherwise, health food stores and the like that come from hemp products. Once again, those CBDs won't necessarily hurt you, but they're not the high quality CBD with THC combination products that I as a physician know are going to work better for my patients. So my point was we need to stop the continued perpetuation of patients spending money where it may not help them as much as the appropriate CBD THC combination product will. So once again, it was a worthwhile session from seeing the direction of which the Office of Compassionate Use is heading. I do believe that what I took out of the session today was the hope that after my patients qualify with the 90 days that the state has laid out as the requirement that we know now, that my patients will have a system and a process to be put into the registry and to go up to the dispensary and get an appropriate medical cannabis product. Once again, I feel confident that's going to happen. Interestingly enough, there has been some discussion both at today's session and within both Senate bills, both the Brandis and the Bradley bill, that the 90-day requirement may even go away. And once again, we'll have to see how that comes down. But I would say in general, it was a very positive session, and we're going to keep our fingers on the pulse of what's going on at the state level, and surely we'll be bringing it to you as soon as we know. So stay in touch, and we'll to our VeniceCare.com site, and you can be kept abreast of all the upcoming and ongoing state legislative issues.